There are many different types of depression and multiple conditions that can cause a person to suffer from it, including genetics. Mood disorders can run in families. Life circumstances like divorces and job losses and financial struggles can contribute. Drug and alcohol abuse, sleep disorders, and medical conditions can lead to it. According to the American Heart Association, up to 20% of people who have a heart attack could also develop depression. In cancer patients, pain, weakness, a poor diagnosis, and certain medications can all contribute to clinical depression. And then in 2016, there was a study published in the journal Pain that reported approximately 60% of people who suffer with chronic pain also suffer with depression. Stroke survivors and people living with lupus, diabetes, multiple sclerosis, thyroid imbalances, AIDS, and Parkinson's are all vulnerable to experiencing depression. Now, my dear friends Ted and Emma were each struggling to maintain their own emotional balance as Ted's Parkinson's advanced. So they started going to a couples counseling program at the neurology clinic where Ted was receiving medical care. So they had gone for several weeks, and then one day Emma just stood up and she just hollered, "Week after week we come here, and the only person that we ever talk about is Ted. And how is Ted feeling? How is Ted coping with the loss of this skill or that ability? I'm just sick and tired of always talking about Ted while I sit by silently and we talk about how hard this is for poor Ted. No one ever asks me how I feel or what it's like for Emma to be losing her husband inch by inch one day at a time. And Ted isn't the only person whose life has changed because of his Parkinson's. So if we are not going to talk about how this is also affecting me, I am not coming back." Well, Emma was pretty blunt, and I'm sure that Ted and the counselor were both taken back a little by her outburst. But you know what? I got it. I understood. For the first 4 or 5 years after Ted was diagnosed, Emma put Ted's needs first, always ahead of hers. But that day, she had reached her limit, and she said she felt like what she needed and what she cared about no longer mattered to anyone. She felt like she was disappearing, and if she didn't do something dramatic right away, she was going to become completely invisible to everyone, including herself. Now, I don't think Emma is alone in feeling this way, because often friends and family members will inquire about the well-being of a person with a medical condition, but they rarely ask caregivers how they're getting along. So Marion, a member of one of my caregiver support groups, said, "One of the side effects of my husband's stroke is depression, and trying to generate enough positive emotional energy to keep both of us up is wearing me down. I am exhausted, and I honestly don't know how much longer I can continue to do this." I believe that we must acknowledge that this is a problem for a lot of caregivers. Now the question is, what can we do to change it or manage it? I believe we have to start by embracing the idea that depression is not a weakness, it is not a lack of faith, it's not a case of self-pity, it is a medical problem that requires medical intervention. So if you or your care receiver are experiencing symptoms of depression like headaches and backaches, digestive problems, difficulty sleeping, lack of energy, changes in weight, feelings of loneliness, and if you are crying a lot or you just feel like you are always on the verge of tears, please call your doctor. Get medication, and then ask for a referral to a mental health professional. Medicare and Medicaid will pay for visits with psychiatrists, clinical psychologists, clinical social workers, clinical nurse specialists, nurse practitioners, and physician assistants. Depression can be a long, lonely journey for the person who has it and for the people who love them. It's hard, but it is not a terminal illness. Help is available for caregivers and their care receivers. There are circumstances that you will never be able to change, but with the appropriate medical and mental health treatments, you can maintain the emotional strength you will need to adjust, to adapt, and to cope with whatever changes and challenges lie ahead. So please make your own self-care a priority. Get the help you need for yourself and for your loved one so that you can live in a brighter, happier place going forward.